Now coming to our main sessions, we have the first speaker as Dr. Ruth R. Robert. She is currently working as the Regional Director of Professional Development, Austin Brown Rock Region, Nursing Continuing Education Department at Texas, USA. Ma'am has done her Masters of Business Administration, Masters in Public Health Management, PhD in Nursing Science from Texas Women's University. She has also received postmaster certification in Family Nurse Practitioner. Ma'am started her journey as staff nurse from CMC Ludhiana, then progressed to Muscat Sultanate of Oman, and then finally settled in Texas. At Baylor Scott and White Health, Madam has worked as Director of Education and Research, Magnet Coordinator, Director of Medical Surgical Units, Chest Pain Coordinator, Stroke Coordinator, Interim Director of Acute Care Services, and held many more positions. She has received lot of awards. I will just name a few awards. That is winner of D Magazine Excellence in Nursing Leadership Award, Chief Executive Officer Awards of Excellence, Employee of the Year nominee, DFWHC, then Nurse Week Nursing Excellence Award, Florence Nightingale Award for Excellence from Baylor Scott and White Garland, and many more. She has more than 50 publications in prestigious journals, and she is recipient of more than 10 academic certifications and member of various international professional organizations. So welcome, ma'am, and we are looking forward to hear from you.
Good afternoon, everyone. Can you hear me?
Yes, yes.
Can you see my screen too?
Yeah, ma'am, please make it full screen if possible.
So good afternoon. Today I'm going to talk about, we do a great work. I heard from President and from Professor Robert that we have so many things. As a PhD, DNP prepared nurses, we masters prepared. We have research which has been sitting in our libraries, but how can we make that research thesis to be available at the frontline staff level? So what I'm going to talk about is what are the tits and bits or nut bolts of writing a good research article. So I'm going to start with my first slide. What is the research question? First, we need to come across when we start thinking about publication, what is a research question? What is the right format for the study? What does the audience need to know? And always remember that what drives our research study and publication is a PICO question. If you look at with the COVID, I just wanted to give an example to show how we can capture in one research statement all those components of PICO. So among patients with COVID-19, is hand washing more effective than use of a sanitizer in preventing the spread of COVID-19 over the period of patient's hospital stay? So it has all the components of PICO question. It has a direction, and it also is a very hot topic. And I bet if we can write some research study on that, want to publish it, definitely it will be accepted, but we need to follow the systematic approach. So now we are going to go to the next one. Why do we want to publish? When we do a good work, we definitely have to, this new knowledge, because research is a new knowledge, and we want to improve the quality outcomes. How do we improve the quality outcomes? When we are bringing that research at the bedside. And how do we do that? How do we publish it? We need to have a systematic approach. And how do we disseminate is very important. And do we have a right audience? Who are our stakeholders? So just again, with the same example of COVID-19, we have a broad scope because it's a new pandemic, never experienced, it will have a new knowledge. So always think about what kind of a topic you want to use. And then once we have all that lined up, now we have a tools for us. We do not even have to reinvent it. Let's take an example of IMRAD model. It has the direction how you need to standardize or just put the thesis or your research topic into a publication using the different components like introduction, methods, results, and discussion. The other way, there are different ways. The other one is like the big thing I will tell you is that the introduction and the middle portion and the final. If we really focus on these three components and correlate with the structure where I added on the left side of my slide, if you look at the first one, the research topic, lit review, and justification and roadmap. And if you can take this to the table, the top portion will be titled abstract, and the body of your report will be, or a research will be intro, lit review, methodology, results, discussion, and conclusions. And in the end, definitely references. We always want to give credit to the resources we use. Now let's slice and dice each component and learn about how we can take each component and able to publish our article. I'll start with the title. Title is the most important part of your paper because that's the component. Either it'll break you or make you. I gave you two examples. One of the research study, if you look at it, the first one is very confusing. Analgesics effect of breastfeeding versus skin-to-skin contact on pain related to heel prick in neonates. It just seems like I lost in between that sentence because there are so many variables and we do not know whether which are independent and which ones are the dependent variables. If you look at the second one, there's a direction, there's a clarity, and it has all the components of PICO questions. Now, the secrets to writing a title. Keep it concise. If you look at the first, I just gave example of the research study. If you are gonna look at the first example of topic, if you want to publish from our research, PCR nasal swab test for the diagnosis of COVID-19, very concise. And research shows, evidence shows that the words we use for the title should not be more than 10 or 15. And also, along with concise, we need to be very specific. Specific in terms of what variables we are measuring. What are our dependent variables? What are our independent variables? And what kind of a population we are trying to study. Sometimes we say elderly population. Nowadays, with graying America, with all generation, with geriatric, there are different terminologies, different levels of ages. How do we define adult? How do we define elderly? So specifying the age sometimes really helps to understand those variables in terms of independent and dependent. Also, the next is use a descriptive of neutral titles. So we have to be very defined in our descriptive because when we do experimental study, you will always see that the study or experiment, the component will be in the end. So if you look at this example, 7 days versus 10 days antibiotic therapy for culture-proven neonatal sepsis. And then what are we doing? We are doing a randomized trial. We are not giving them a direction or creating a bias so that it's very neutral. Either it is a 7 days or 10 days. So always remember that whenever we are doing experimental or descriptive studies, make sure that your title is not creating a bias among the readers or the editors. The next one is avoid interrogative or declarative titles. If you look at the next one, prevalence of crypto in HIV infected children with diarrhea, or crypto is the most common enteric pathogens in HIV infection. So if you look at the second one with the red highlighted fonts, it just seems like we are already creating a bias among the leaders. We need to avoid that because we want to have an unbiased kind of a statement so that it gives us a direction, and when we do study and results, we will get the results based on our statement. Sometimes we use too many acronyms and abbreviations. One of the example I have put it here is diagnosis of ARF in children. It's very distracting because we do not know, is it acute renal failure or it is acute rheumatic fever? So we have to be very careful when we use abbreviations. Some of the standardized Webster dictionary also is approving, like HIV and others. This is a great example. They are approved, but some of them which are very biased, we should avoid those. And also, this is a very good way to remember what should include in your title, the acronym SPICED. What kind of setting? Because setting will drive to understand. If you are going to learn about, this example is about hospital-based study, mortality in severe acute malnutrition in under 5 children. If we are not going to set up the study, if we say community, and then our numbers are high, then sometimes the generalization becomes distracting. So hospital setting, we expect that mortality will be more than in the community. Because who comes to the hospital? Those who are severely malnourished or having other kind of complications related to that. So setting is very important when you are going to focus on the publication. What kind of a population? I already explained to you in the previous slide also. So we need to define osteoporosis in postmenopausal women. It'll be more than we are just learning about prevalence of osteoporosis in men. So defining population will drive your results. The next part is intervention. When we are thinking about an intervention, what kind of a study we are doing? A randomized control trial is the gold standard of any kind of a clinical trials, which can give us the best results. So if you look at the study, therapeutic effect of vitamin D supplementation in children with severe asthma. So there is an intervention, correct? So when there is an intervention, we are correlating. It is a good study and it's more of a experimental. There's a quantitative and qualitative, so it's more of a quantitative. The next one is a condition. If you look at this example, this is an example of a pregnant woman. What kind of a condition? This will also drive your research study and publication part of it. Endpoint. Always remember that outcome should not be listed in the beginning. Your statement and problem statement should bring the outcome in the end. So endpoint should always be considered when we are writing the research topic, but at the same time, we are not disclosing the outcomes in one direction. The last part of is design. What kind of a design we are going to use it is important. It completes the study. And always you will see that whenever we are talking about a design, it always comes after the title and usually placed after a colon. One of the example I shared with you right here. Now we are good with title. Now what about abstract? That's the second part. Anytime, any leader, even a student in an academic student in PhD scholarly work, they are doing or trying to find out some of the research studies, they really focus on abstract. Abstract is the key to decide whether to proceed with rest of your 7 to 20 pages of research paper, or we just need to drop that idea. So it gives per day, there are like probably 100 to thousands and millions of abstracts read globally. But when you look at the complete whole research study, it's minimum 20 to 30% of that amount. So that speaks volumes. How we write abstract is very important for, it's a selling point for any kind of a researcher. And it usually summarizes your entire paper, what you're writing about. There are two ways you can write abstract. Either you can do a traditional paragraph or a structural summary. It's always good to have a short paragraph. You do not want to write 2 pages of abstract. You will lose your audience in between, even in first 2 sentences. And word limit for abstract usually is, it varies from journal to journal. I was looking through a nursing research journal. Usually they have divided it into background, objective, methods, results, and discussion and keywords. So always remember that. If you are going to pick up some journal, you want to make sure that that journal has its criteria, follow the criteria. Then comes the introduction. What does the introduction do? It provides background of your study, its purpose, and its importance to help readers to understand your research study and identify the question, the research address. The author should begin with a discussion of specific problem that includes a statement to pique the audience interest. Very important aspect is that it gives a background. It helps us to provide a background, what kind of a study we are doing. It should be clear, organized, and should be established. Basically, we call it a blueprint. It's a blueprint of your manuscript. So always remember that how you drive this manuscript will help in making you successful in publishing your research study. Let's go to lit review. The lit review depends on what kind of a study you are looking into. Is it experimental or is it just a descriptive? And then also along with that, it should have a balance of both supportive and contradictory research. You cannot, let's say that if you want to learn about a rapid response team, you want to always focus on some of the research studies when you are reviewing, what are the pros they are talking about, and also some of the studies which are focusing on cons. Pros and cons are very important when you are going to focus on your lit review. And also, always remember that usually the editors, they prefer the recent journals, 3 to 5 years. But some of the paradigm articles, research studies, which are like old, but sometimes they are the gold ones. So please remember that if it is very specific and it's a paradigm article or a research study for your kind of a study, definitely include, irrespective of whether it is 3 to 5 years old or not. And always make sure that you're having a logical connection between your studies. And in the end, I have seen journals, I love those journals who have a table which summarizes the whole lit review for you. And also it gives us a direction and easy to learn and read about it. And it also drives your readers towards your manuscript and research study. Also, it is important to have a framework. There is a theoretical framework and conceptual framework. If you are doing a grounded theory, there is a Strauss. He has a great ideas. There is a great framework for that. And if it is a phenomenology, depending on what kind of a study you are doing. Sometimes you will see both conceptual and theoretical framework in the research study. If you are using that, make sure you reflect in your writing also when you are trying to publish it. Usually the conceptual is more of an abstract, theoretical is more of a concrete. Now let's talk about methods. Why do we care too much about methods? Because it allows our other researchers who are trying to locate your research study to generalize to other settings or to do a further research on that. And also it also helps to determine whether the conclusion seems valid and also whether the finding seems applicable to other situations. Those are very important because they want to make sure, can we take this study and just use in other setting? Are they going to bring the same results? So definitely we can replicate. You will see so many studies are replicated. When we are doing the methods, always remember that we do not miss these 4 components. What is your research design? What is the sample and setting? What is your data collection instrument? What procedure and data analysis you are using it? For example, for the quantitative, don't forget that whenever we are doing a quantitative, along with what kind of a design, we need to take it further to next level, what kind of a categories of design we are talking about. If it is a descriptive correlational, or it is a quasi-experimental study. And always make sure that you are specifying in your method dependent and independent variables for your studies. So this is just an example, because this is, in general, when I review some of the research study for our system, it's a big system. We have like around 40 hospitals. I definitely feel like there's a weak area, there's opportunity for our scholars who are trying to write. Sometimes they miss some of the things out. It's like a Bible for experimental research. You should always make sure the listed components are in your experimental research, which is defined. And sometimes I've seen the sample size is being mentioned, but there is no power analysis. Power analysis is very important for experimental studies and when you are having assumptions related to your research study. Now, after that, results. What results do? It tells your story. And what you need for that? You need to display your tables to show the evidence that the probability was there. The chi-square showed the relationship. T-test was able to prove the hypothesis. All those are so important. And why do we use figures? Figures are important to highlight major concept or major results. When we do data analysis, always make sure that we are only including not all 50 tables or 20 figures. Always make sure you are highlighting your research study. You are not writing again research, correct? We have already done a great job by writing a 350 pages research study. Now it is a time to highlight the high level things. So always remember that. Also, I have seen major mistake they do that in the results section, they start putting discussion. Discussion should not come in the result section of it. When we are doing a quantitative study, always make sure that you support the study purpose and research question. And also summarize the statistical significance and what kind of a test you have used and why did you use t-test, why you did not use a chi-square. This is very important to rationalize and defend yourself. What are the common mistakes when we are sharing the results? Sometimes we are so emotionally driven. We want to just, whatever is our bias towards the study, we try to overuse or abuse those tables and figures and the findings. We need to be unbiased, logical, not illogical, and always make sure that we are fair in sharing the data points. Whether you like it or not, it's not about driving what you want, it's about the fact or a component we are studying. And then also I've seen in some of the results section, usually the conclusions are added. Conclusion should not be added in the results section, it should be the last part of this. So let's talk about discussion. When we do a discussion, it should answer the question stated in the introduction. You will see editors, when they are looking at your research study, they'll go back and forth. They will look at your questions and introduction. And also, whatever you discuss in your discussion section, they will correlate with what you covered in your introduction. Sometimes we do not see that, but there should be a correlation and there should be a chain. And we try to find the chain. Are we really making the trail, what we are studying, or we are just breaking that chain? And also, when we are talking about the discussion, always remember that limitations and implications are highlighted in your discussion part. And then it's not easy because sometimes we are like with scholarly work, we want to do everything and anything in the discussion. We definitely want to cut down our discussion to very short 300 words or so, but it should convey the message and connect with our introduction. Common mistakes, repetition of data. Whatever you shared in the results, you are again reflecting in your discussion. And sometimes your conclusions are not supported by findings. Sometimes you are just focusing so much on strengths that you forget to talk about the weaknesses. We definitely want to focus on weaknesses too, because the person who's going to take to the next level your research study by replicating, they can use that weaknesses and probably rectify that and make it more stronger research studies. When we talk about the conclusion, it should be a separate and last section, and it should answer the questions. Now let's talk about references. Although there is no limit, time limit for the references, as I said before, if it is a paradigm research studies which you are extracting to write your research study as well as writing the paper. Usually it is alphabetically arranged. I was looking through a journal like Nurse Educator. They do not want it to be alphabetically arranged. They want to refer it based on the order, how you are citing in your manuscript. So it is very important that when we come to references, sometimes we are so exhausted and we don't do a good job. Remember that the beginning and end is the most important point when the reviewers are going through your research study. Tables. As I said, that tables, just highlight the tables which are going to be reflecting the results, and they are the paradigm tables. It's not every table should be there. If it is experimental study, I definitely want you to include the t-test or chi-square, more of a inferential tables, inferential statistics should be reflected in your tables. Figures. Just try to focus on figures which are really going to highlight your tables and also show the relationship of the variables. It can be graphs, it can be charts. Now let's talk about all these. We talked about all the components. Now, what is the big thing after learning all those things? Let's summarize together publication tips. We need to have a strong introduction. We need to have a method which is very clear. Results, which has a highlighted table, text, and figures. And discussion should be very strong. What are we achieving there? What do we want to highlight? What to avoid in the paper? Superficial literature, because we want to have references, 50 of them, because it doesn't look if I have only 10. That's not the criteria to add that reference in that. Also, sometimes we try to sweeping the generalization because we want that. So all those things we need to avoid. Also, the rhetorical style that does not match your journal, what you are writing for, please do not use that. And the big thing is, I'm listening to Smriti about all the bios of President and Professor Rawat. This is a node. We need to be a node in the network. How can we be a big nodes? If you look at the picture on the right side, those highlighted blue nodes, so we are outstanding. We cannot be just lost in the other ones. How we can be? If we are a member of professional organization, if we are attending those national, international, or annual meetings, or stand for election for executive committees, or accept invitation to become a member of editorial boards. And now, the big piece when we are writing a research study for publication is you need to know your editors. there are three kinds of editors: editor-in-chief, managing editor, manuscript editor. All three of them are very important, although they played important roles. But I will say that all three of them collectively will make you or break you. What are they looking for? Quality. Is it well planned? Not only planned well, but it is executed also planned. And what is the significance and originality of research? Research is very different than performance improvement evidence-based. It's a new knowledge. So is it a new knowledge? Is it consistent with scope of journal? Well-written story. Is the author really passionate about writing? All these things are considered when the editors are accepting or rejecting the manuscripts or research studies. So that being said, remember that a good beginning makes a good ending. We need to always think that. And then with that, I will say that don't forget the final step. Celebrate publication of your research paper. Sometimes we are not celebrating enough. Thank you.
Thank you so much, ma'am, for this beautiful presentation. And it was so nice to see that all the important points you have covered so clearly and so beautifully in a very short period. I hope the readers have enjoyed it. And I was going through the chats and everybody was asking for the PPT. So we'll see what we can do about that.
Absolutely.
Okay. Yeah. Thank you so much, ma'am.